Hello everyone, it's Dr. Adam here, and today we're going to dive into a concern that many of you have raised with me, not only in the office, but also online, and that is how to sleep comfortably when you're experiencing low back pain. Finding the right position can totally make the difference between waking up in a recovered and well-rested state or not. So let's dive in. So first off, you need to understand two key variables, and that's if your back hurts more when you flex forward, or does it hurt more when you extend backwards? The reason why we need to identify this is we want to locate the root cause, or at least we can have a better understanding of what that is, and we can better position ourselves while we're sleeping. There are two tests that you can do that can help you determine which one is causing it. So the first one is bending forward, just like you're going to bend down and touch your toes. There should be some discomfort and it should feel like you're experiencing stiffness in your low back. You may also notice positions like driving for 20 to 30 minutes cause more pain, or just sitting on the couch on your favorite chair might cause more pain. Now the second thing you can try is extension and rotation into your back, and there's a test called the Kemp's test, which is basically looking at compressing together the small joints in your back. And the way you do this is you rotate to the same side. So for example, we're gonna go to the right side. You're gonna rotate all the way. You're gonna put your hand on the back of your hamstring, and while you stay rotated, you're gonna drop your hand down and try to touch the back of your knee. If you feel pain on the same side of your low back, then we're gonna want to avoid certain positions, and that's how you know it hurts with extension. Now, for both situations, we want to position ourselves so that we create relief for the low back. So for example, if forward flexion causes pain throughout the day, then in the low back, what we want to do is we want to work into extension to help create relief. This is going to decompress certain areas of the back. So let's get into a few sleeping positions. So if it does hurt more when you flex forward, then we want to decompress the spine while also creating a neutral low back at the same time, because this is going to keep your back in a more protected position while you sleep. So ideally when you're sleeping, you can sleep on your back. You want to place pillows underneath your knees. This helps to maintain the neutral curve in your spine, and it also decompresses, takes the load off the low back as well. The other thing you can do, especially if you have a very soft mattress, is you can roll up a small pillow or a t-shirt under your low back. Now, this simple trick will give you additional support to your low back, and this will ensure a pain-free sleep. For those who find pain while they're extending or when they do the Kemp's test, you will most likely be better sleeping in a position where you're on your side. So for certain conditions, you'll find one side more comfortable than the other. So you have to make sure to try this out, and you're always going to work into the position of relief, especially when you're sleeping over an 8-hour period. So when you are sleeping on your side, you don't want to have your legs extended. You want to sleep more in a fetal position with your knees drawn up towards your chest. And you want to definitely avoid sleeping on your stomach in this position, because that will extend the back and put you into a compromised position in those facet joints. Now, sleeping in a fetal position, with your knees up to your chest, it opens up those facet joints in the back and help to provide a little bit of relief. This is also a great stretch to do just while you wake up and get moving through the day. Is you can lay on your back and or on your side and bring one knee up at a time towards your chest and just hold it for about 20 to 30 seconds to provide a little bit of relief to your low back. Now, whether or not you're in pain or not and you are sleeping on your side, one thing that is really important to remember is when we're on our side, what happens is when our knee drops down, we create an imbalance in our pelvis, which essentially causes rotation and curvature in our low back. So that causes an uneven strain to the lumbar spine. And what you can do to counteract that is put a pillow between your knees. So for most people, one pillow is enough to realign their hips and take the pressure off their pelvis in the low back. But some people that have a wider pelvis relative to their knees, they're going to notice that there's a lot more rotation and drop in the pelvis. So therefore you might need a thicker pillow, or you can throw two pillows in there to help create great alignment in your spine while sleeping. Now, the last thing I want you to avoid doing in either of these conditions, especially if there's an acute flare-up of this condition for you, is to avoid heat before bed. This is going to cause more blood flow to the area, and then when you're sleeping for 6 to 8 hours and not moving around, it's going to cause that blood to pool and seed in the area. So when you wake up, you're going to feel more stiff. So this can perpetuate the healing cycle a little bit. Even though it feels good and it's soothing during it, don't use it right before bed. Now, finally, everybody's body is unique, and while these are just general guidelines, it's essential to find out what's most comfortable for you. If you continue to experience pain, or you aren't getting better with using these techniques, then don't forget to reach out to a practitioner in your area. And you have to remember, everyone deserves a good night's sleep. So let's try to get as most comfortable as we can as we're sleeping.